the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. Americans may soon be able to get cholesterol-lowering medications and other widely used prescription drugs without seeing a doctor. Now, what does that actually mean for you? Joining us this morning to explain is Baptist Health cardiologist Dr. Scott Davis. Dr. Davis, good morning. Thank you for being here as always. This is interesting because we see a lot of commercials for this and a lot of prescription medications.
That's right.
See your doctor. You know, that's always the line that we hear in them. But now something might change in that form to where people can just go and get it?
Yeah, so there's been a release by the FDA, Scott Gottlieb, director of the FDA. They're looking at a new program to deregulate certain medications for chronic conditions like high cholesterol, high blood pressure, asthma, other medications like naloxone, like you were talking about earlier in the segment on Demi Lovato. And so what it will allow then is access for the individual and then also create a more competitive environment to lower cost. Because the concern is, all right, if you deregulate it and allow access to some of these medications without a prescription, well, then your insurance is probably not going to cover it, right? But it will be a task of the medication providers, of the pharmaceutical companies, to then try to work around the competitive piece to lower the cost. And so they're anticipating next year being a more formal guideline as to how this will work. So, for example, you're on cholesterol medication. You will go on
prescription, let's say, right?
Prescription.
Yeah,
And so to get it non-prescription, then you will go online. Then the FDA will have an app that you will go online, fill out certain questions to make sure you would qualify, and then you could then get that medication. This has been tested over the last decade or so, and it's just never quite gotten good footing because of concerns about competitive pricing and about access and for certain pharmaceutical companies to chin the bar on the regulatory piece. But, you know, if you look at there's some 75 million people in the U.S. that have high blood pressure. 1 in 3 have high blood pressure, but only half are to goal or to target with their blood pressure. Some 43 million people in the U.S. need cholesterol medication, but only half are on it. So the goal here is to get more folks on medications. This whole thing has got a precedent with like your reflux medications, like for heartburn, like the Prilosec and Zantac. That model has worked so far. So you could, in the past, you would have to have a prescription to get Zantac, but now you can get a lower dose of it over the counter. So we'll really see how this goes, but it's certainly encouraging because the goal is to facilitate more access, to empower the individual more, and yet to create a competitive environment that will lower the cost of the medication.
All right, something to look for in the future. Dr. Davis, thank you as always for coming in and explaining what all this means. You can contact Baptist Health at any time at the Baptist Health Line, the number on your screen.